In the 1980s, an acronym, RICE, was coined in the management of acute injuries: rest, ice, compression, and elevation. The doctor that coined this recently, I think in 2016, actually said he may have been wrong about the ice part. Recent evidence has shown that ice may not actually be the most beneficial thing in managing the recovery of an acute injury. And I want to make that distinction early. I'm not talking about managing pain. It is very, very good at doing that. It has a great analgesic effect from the evidence that we know. What it doesn't do well is aid us in progressing our healing, which is something that I think a lot of people assume about ice. This doctor that coined the term effectively has looked at the recent research, which has shown that swelling is very, very much crucial to the healing of an injury. So when our ankle swells after we sprain it, when our wrist swells after we sprain it, the cells that get sent to that area as part of that swelling are crucial for drawing damaged tissue away and starting off the production of the factors that aid in regeneration or generation of tissue. There was an article recently that was written based around the effect of ice on healing or cellular recovery time, and that was done on a rat population. So what they did is they chose two groups of rats. One, in both of them, they created the same kind of damaged tissue. I think it was in one of the hind legs. They damaged the tissue somehow, not quite sure how. And in one group, iced the damaged site, and in the other group didn't. What they found was pretty interesting. In analyzing the tissue after 3 days, 7 days, and I think 15 and 21 days onwards, is at the 3-day mark, the cells or the tissues, the things in the tissue that showed that healing was occurring, was actually significantly more along in the non-iced population than the iced population. So those that had ice treatment after this injury, and the ice treatment was only once, which is different to a lot of how we look to manage things, but still gives us an interesting insight. The ice group definitely had less of that recovery process having started in the early days. In the late end of management, it didn't seem to make too much of a difference. There's a time and place, obviously, and it's based on your priorities. So the use of ice in managing injuries, in talking to people, I will tell them for the moment, depending on the information that comes in, because that's how we work as evidence-based practitioners, is that if it is to help them manage their pain, short doses. And I mean short, a couple of minutes, okay? We know already that ice, actually the cold feeling of ice doesn't go any deeper than the first couple of layers of tissue anyway. A couple of minutes to make you feel a little bit better, okay? What I may tell them as well is that if they're doing it to help them recover faster, then don't worry about it. It's by the looks of things, it's probably not the thing that's going to aid you in getting better quicker. What we know is that moving a little bit within the tolerance of that tissue, even if it is a little bit injured, within the tolerance again, because that's really, really important, and effectively trying to keep yourself going as much as possible is probably the best way to get you back to your best as quick as possible. Next time you roll your ankle, next time you've gone to the gym, worked a little bit too hard, and you feel like you're reaching for the ice pack, then maybe double check with your physio, maybe double check with your health practitioner as to what the best way to go ahead is, because it may not actually be the first thing you think, which I think for a lot of us at the moment is ice. So it's definitely gotten me to think twice about how I manage people and what to do next.